Cardiovascular, pericardium, heart, blood vessels. Part 1. Objective: surface anatomy of the heart, to know the pericardial sac, chambers of the heart, arterial blood supply and venous drainage system of the heart, and the conductive system of the heart. The pericardium. We have to know the layers, sinuses, nerve supply, and some clinical problems, pneumopericardium or pericardial effusion or pericardiocentesis. Now, the blood supply of the heart, you have to know introduction, the origin of the coronary arteries, branches of the right coronary artery, branches of the left coronary artery, and the anastomosis of the coronary arteries, blood flow in the coronary circulation, distribution of the coronary arteries, variation of coronary artery, vein of the heart, coronary imaging and ventriculography or balloon angioplasty, and some clinical correlation subjects. The heart. The heart, we have right and left atrium, right and left ventricle, and there are two types of valves, either cuspid valve, we call it mitral valve, and tricuspid valve, or we get semilunar like valves, we call it aorta and pulmonary valves. The pericardium is a fibrous sac that encloses the heart and the root of the great vessel. It's a strong outer called the fibrous pericardium, closed double layer called the serous pericardium. The fibrous pericardium is the outermost layer, is conical in shape, can be compared as a back in which the heart lies, the green part of the figure. Fibrous pericardium, the apex of the pericardium or the mouth of the pericardium is superior and fused with the anteriorly the pericardium attached to the sternum by a weak sternopericardial ligament. The wall of the great vessels is a broad base fused with the central tendon of the diaphragm, from which it cannot be separated. The serous pericardium is enclosed within the fibrous pericardium like the outer serous membrane, pleural peritoneum. A serous pericardium consists of parietal and visceral. Parietal serous pericardium, the parietal layer line the fibrous pericardium from inside, firmly attached to it, while the visceral serous pericardium surrounding the root, great vessel, and the parietal layer of the serous pericardium is reflected to become continuous with the visceral layer that covers the heart and is adherent and cannot separate it. So it's called epicardium. The pericardial cavity, a potential space between the parietal and serous, similar to the pleural cavity. It contains a thin film of fluid which enables the heart to beat in frictionless environment. Sinuses of the pericardium are formed during the development of the heart. The serous pericardium can be compared to the pleural, except that the lung has only one hilum while the heart has two. Development of the pericardial sinuses. The heart first appears as a tube in the pericardial cavity, suspended from the dorsal wall by the dorsal mesocardium. The heart tube penetrates the pericardial sac. At its two ends, the arterial end and the venous end. The arterial end split into two, aorta, pulmonary. while the venous end split into six veins, four for pulmonary venous and superior and inferior vein, vena cava. Development of the pericardial sinuses. With elongation and binding of the heart tube, the two arteries and the six venas pierce the pericardium in the adult pattern and the sinuses are formed. Transverse pericardium is a gap between the arterial and venous, and is caused by disappearance of the aorta dorsal mesocardium, thus producing communication from the right to the left. So it's between a gap between the arterial and venous end. Transverse pericardium is a finger placed in the transverse sinuses, pass in front of the superior vena cava and behind the aorta and pulmonary trunk. It is through the transverse that ligature is passing to occlude the arterial hilum of the heart, aorta, and pulmonary during cardiac operation. The oblique sinus is a S-shaped take by heart tube lead to a formation of blind sac called B.U.C.O.M behind the heart and below the venous hilum. This is oblique sinuses. The oblique sinuses of the pericardium lie between the two left and pulmonary vein, between the two left pulmonary veins and the two right pulmonary vein. The inferior vena cava. It is anterior wall formed by posterior wall of the left atrium between the four pulmonary veins. Posteriorly is related to the esophagus. The oblique pericardium sinus may be entered inferiorly and will admit several fingers. However, a finger cannot pass around any of its bordering vessel. Nerve supply of the pericardium, the fibrous pericardial, the fibrous and parietal pericardia are innervated by phrenic nerve, a somatic nerve, the visceral of the pericardium by autonomic nervous system, the vagus, parasympathetic and sympathetic. This arrangement of innervation is common to all serous membrane. The parietal layer of all serous membrane has a somatic visceral innervation, and the visceral layer autonomic. So the parietal layer has serous membrane has somatic innervation, while the visceral layer in all body has autonomic nervous system, similar to the pleura of the lung. This X-rays show you different clinical problems. This is a pneumothorax, means there will be a hard space between the parietal and serous and visceral pericardium. This space is filled with air due to problem accident, means there is air in between the layer in the pericardial cavity. Can be seen. Normally cannot be seen. Similar to occur in the pneumothorax. Rupture caused by rupture of lung result in dissection of free air into the space between the pericardial spaces. The arrows show you these spaces. Small arrows on the figure show you the way of the heart there is air in between the pericardial space. Now, large heart in this figure, pericardial effusion, accumulation now fluid, not air, within the pericardial sac between the visceral and parietal serous layer of the pericardium due to pericardial effusion, which is a disease may be caused by several systemic diseases. If a large amount of fluid accumulated, this leads to cardiac tamponade, so we cannot, if we put the stethoscope, we cannot hear the beating. The accumulation of fluid usually, sometimes, blood within the pericardium. The increase of the pressure restrict this will filling of the heart during diastolic. So if there is fluid or blood, it will disturb the cardiac systolic and diastolic. Eventually the heart stops if the tamponade is not relieved by pericardial puncture. If we stop this, we have to evacuate this blood. This is done by insertion of needle below the xephosternal in the left costal xiphoid angle. The needle incline in 45 degree. The patient transverse plane and angle slightly medial to avoid injury to the superior epigastric artery. This is a branch from the internal thoracic artery. Now, the care should be taken not to hit what we call the coronary arteries or puncturing the coronary arteries. Inclining the needle more below the angle of 45 may be enter the peritoneal cavity and its content. This is the procedure of doing. The needle passed to the skin, superficial fascia, rectus abdominis muscle, and to the angle 45 degree between the xephosternal angle to the left side. The needle, if correctly placed in its position, slightly over the diaphragm, so the pass through fibrous and pericardial serous pericardium, so we can evacuate any blood. Pericardial effusion. This is showing normal X-ray on the left and the right fusion. Thank you for your